Munchausen syndrome is a disorder where someone pretends to be ill, usually physically ill. Now, generally, people with the disorder take on the role of the sick patient, so that they're the centre of attention, the centre of people's care and attention. Many people confuse this with pretending to be sick in order to claim benefits, for example, but it's completely different. Pretending to be sick to claim benefits is fraud. This is actually a mental illness, and is named after a fictional German aristocrat called Baron Munchausen, who was renowned for telling crazy, wildly exaggerated stories about his various travels around the world and to Russia. It's quite a good book, a little bit old-fashioned, but it's quite good. So what do Munchausen sufferers do? Well, they sometimes pretend to have mental health disorders that they don't actually have. Usually severe ones as well, like hearing voices or having more than one personality. They might pretend to be in chronic pain, and in some cases they even undergo serious surgical operations just to keep up the facade. Now, we don't know what causes it, but we do know that it can have its roots in emotional trauma or extreme childhood illness. We know that it can be linked with some personality disorders like antisocial personality disorder or borderline personality disorder. There's no hard and fast treatment for it, unfortunately, but generally CPD, which is cognitive behavioral therapy, and psychoanalysis tends to be a good start. The problem is that most sufferers refuse to admit that they actually have it, and that makes treating it incredibly challenging.